There's nothing simple when it comes to medical coding and billing. In March of this year, Cigna, in their infinite wisdom, resurrected a policy that they tried to implement in 2022, but abandoned it. What they will do starting May 25th of this year in 2023 is to require the submission of additional documentation whenever a modifier 25 office visit claim is filed for payment. This poses a significant administrative burden and uncertainty regarding payment for these types of visits. In urology, a modifier 25 visit is very common. In this video, I will discuss what actually may happen once May 25th, 2023 hits, and how you can navigate this additional administrative burden. For those of you who do not know me, my name is John Lin. I'm a urologist in Gilbert, Arizona, also your humble host of the Thriving Urology Practice Facebook group, where we crowdsource practice management solutions for everyone's benefit. I received a lot of updated information from a webinar that I just viewed, and this webinar was held by the Arkansas Medical Society on April 20th of this year, entitled Cigna Modifier 25 Update. In this webinar, Dr. John P. Keat, who's also the National Medical Senior Director for Affordability and Special Partners for Cigna, presented on what actually will, or who knows what will happen, will or may happen once the modifier 25 policy goes into effect. But before we go there, let me share with you what the letter that was sent out in March of this year. This Cigna letter states that because they reviewed the modifier 25 use and how it may be wrong in a lot of cases, they decided to require the submission of office notes with claims submitted with evaluation and management CPT codes 99212 through 99215 and modifier 25 when a minor procedure is billed. Now, this is the important line right here. The E&M line will be denied if we do not receive documentation that supports that a significant and separately identifiable service was performed. Denials will include administrative appeal rights. And let me read this again. The E&M line will be denied if we do not receive documentation that supports that a significant and separately identifiable service was performed. Now, that to me, when I read that, means they are going to match the documentation that you submit before they will adjudicate and pay the claim, and that the E&M service will not be paid if they do not receive documentation that supports a modifier 25 event has taken place. That is as clear as day when you read the letter that is sent out to all Cigna providers. Now, in the explanation Dr. Keats will have in this video, you will hear something very different. So it is clear based on the webinar that was held that a lot of comments came from the listeners. Clearly, they do not understand what a modifier 25 event is. When can you appropriately bill a modifier 25 event? And for those of you who are still confused, just YouTube John Lin MD and modifier 25. John Lin MD modifier 25. Search on YouTube. There are tons of videos where I explain what is a modifier 25 and how you appropriately use it. This rule, apparently, going into effect on May 25th of this year, will apply to all Cigna plans and all Cigna providers, according to Dr. Keat in this webinar. So, how do you go about submitting claims whenever you have a modifier 25 attached to it. So a CPT and an E&M with modifier 25 attached to it. How do you submit these claims to Cigna whenever it happens? Let's listen to what Dr. Keat says, how you go about doing that.
So when that's the case, what we ask you to do is two things. Number one, there is an indicator on an electronic claim that can be set to show that you've made an attachment. Although at this point we're working on it, but right now with original claims, you can't actually attach your office notes directly to the claim. That may be changing at some point in the future. I'm working with our IT people, but right now you can set the indicator but not actually attach anything. If you set the indicator showing that that there is an attachment, even though there isn't one, both claim lines will pay promptly. There's no delay in your payment. We're not going to be trying to match up your office notes to the claim before we pay it. If you set that indicator, the entire claim will pay. We then ask you, we've set up a dedicated email address and eFax number that you then send your office notes, and then those will be audited at some point in the future without holding up your payment. So there will be no delay in payment. If you do not check that indicator and you have an E&M modifier 25 claim line, then the procedure will still pay. Okay, so again, no hold up in payment, and we will deny the E&M modifier 25 claim line. You will then have the opportunity, if you choose to resubmit that claim. On a resubmission, you can attach the office notes directly to the resubmitted claim, and then that E&M claim line will pay. And again, we will audit at some point without holding up your claim payment. The point being of this program is to try to make sure that people are thinking about whether it's appropriate to include that E&M modifier 25 claim line when you're doing an office procedure. You have to ask yourself, have I addressed a significant and separately identifiable medical problem during this visit? And did I document that appropriately in the record? We know a significant amount of time that that's in fact not the case.
So a lot to unpack in that short video. Okay, first of all, whenever you submit a claim to Cigna starting on May 25th of this year, whenever you submit a claim that has a CPT procedure, that 0 and 10 day global or 10-day global procedure, and you provide an E&M service whereby you attach a modifier 25 to the E&M service for established patients only, of course. You have to, whenever you submit the claim, you have to somehow turn on the attachment indicator when you submit the claim to Cigna. So I personally don't know where you turn on the attachment indicator, maybe on their website, or is there something that you do on your practice management software where you click a box that says attachment, there's an attachment, but you don't really attach anything. You don't attach anything because Cigna currently does not have the capability of accepting an electronic attachment whenever you do a modifier 25 E&M visit with a CPT. Literally, that's what he says. They are unable to technically support an attachment whenever you do a modifier 25 E&M with a CPT. Okay, so that's number one. Interestingly, despite what the documentation, the letter that we received from Cigna initially, the E&M line will be denied if we do not receive documentation that supports a significant and separately identifiable service was performed. So despite that, what Dr. Keat said is that as long as you submit the claim and you check the attachment indicator, both the CPT and E&M will pay when you attach a modifier 25. That is clearly very different than what the letter said. So let me reiterate. Even though you're not attaching supporting documentation to that particular electronic claim. When you submit the CPT with an E&M and a modifier 25, and you simply check that attachment indicator, wherever that is, your claim will be adjudicated and paid despite Cigna not matching or not receiving the supporting documentation. That's literally what Dr. Keat said. Clearly very different than the letter that we all received from Cigna. What will happen, apparently, is that once you do submit the additional supporting documentation via one of the ways that they outline, most of us are most likely going to be submitting it through electronic fax. They will later on audit the medical necessity and the correctness of the E&M visit with the modifier 25 attached to it. So this is more of an educational tool, an auditing tool, apparently, as you'll see later, than a way to delay payment. We will see what actually happens when May 25th comes about. So let's just say that if you submit the CPT code with the modifier 25 attached to the E&M, let's say you submit that claim. But if you do not check the mystical attachment indicator, then what happens? Well, Dr. Keat said that the CPT code will be paid, but the E&M visit with the modifier 25 attached to it will not be paid. So what will happen is that you will have to resubmit the claim, and you can then apparently attach the office visit notes on the resubmission. So that is what's going to happen if you forget to check the mystical attachment indicator. So my question is, how do you turn on or attach or click the attachment indicator, right? That's the big question. And I think maybe you have to do it through Cigna's website whenever you astute coders and billers submit the claim. So I'm going to leave that up to you. And if you can leave in the comments how that is actually done, I would greatly appreciate it. So here's my question. What if Cigna, and say you submit the CPT with the modifier 25 and an E&M, you click on the attachment indicator, and then you subsequently submit the supporting documentation. What if Cigna can't find that supporting documentation that you electronically faxed? Are they going to come back and ask for it? So that is more administrative burden on you, the practice. And also, I'm thinking, if there's no penalty in submitting the claim with the modifier 25 and an E&M with a CPT, if there's no penalty, then why even bother submitting the e-fax, right? If there's no stick, if you're still going to adjudicate the claim appropriately, then why even bother submitting the documentation? So that's another question, right? So this is nothing but a massive audit by Cigna to see if a lot of providers who submit modifier 20 claims are in compliance. So let's answer why this Cigna program is being done. And Dr. Keats explains in this short clip.
The point being of this program is to try to make sure that people are thinking about whether it's appropriate to include that E&M modifier 25 claim line when you're doing an office procedure. You have to ask yourself, have I addressed a significant and separately identifiable medical problem during this visit? And did I document that appropriately in the record? We know a significant amount of time that that's in fact not the case. The reason we've chosen to go this route is because we didn't want to do what many of our competitor plans have done, which is they simply have reduced the payment by 50%. That's the most common reduction. And I think that's unfair. I think if you're using E&M modifier 25 correctly, you should be paid 100%. of what you're due for that work. And to cut everybody by 50% is punishing everybody for the misuse of that code and claim line by somewhere around a third of people submitting claims.
Okay. In this webinar, he says about 30% of the claims being submitted to Cigna with the modifier 25 is wrong. So he's saying, oh, we are doing you all a favor. What a joke. We're all doing you a favor by not cutting payment by 50% whenever you submitted modifier 25. Well, cut me a break. What about the 70% of us who are submitting modifier 25 claims correctly? You're now punishing us for the 20 or 30% who may be submitting it incorrectly to Cigna, right? What about those of us who are doing it correctly? You're punishing all of us for the 20 to 30% of people who are doing it wrong. Let's listen to how he rationalizes and explains why Cigna is doing this further.
So we think this is a fair way to do that. We understand that this does create some administrative burden. We've tried to set it up in a way that does not delay payment to anyone so that it's not going to affect your cash flow. We will be auditing these, and for those who are using the modifier 25 inappropriately, we're not going to try to claw back what we've paid you or anything like that, but we will want to educate you so that hopefully you stop using it inappropriately in the future. And then, of course, we will monitor those people a little more closely to make sure that their behavior has changed. So I think there's been a lot of misunderstanding as to the scope of this. It's probably not as many patients in a day or in a week as some of you may have thought or feared. Many people thought this was going to delay payment while we matched up office notes to claims or audit them. That's not going to happen. You're going to get paid the same way you're getting paid today. We will be auditing, and those who we find that are using this inappropriately will receive targeted education so that they can stop doing it in the future. And what we're hoping is that people who are using it inappropriately now will simply stop using it, because of course, if you don't put a modifier 25 E&M code on your claim with your office procedure, then it doesn't hit this edit. You don't need to attach anything, and you'll be paid for the procedure. So we think this is a fairer way to go than many of our competitors have taken. We think it's not going to be nearly as burdensome as many of you out there have been fearful of, and we're hoping that people understand why we do this. We have a fiduciary responsibility to our clients and customers to make sure that all claims are coded appropriately. And if a significant number of E&M modifier 25 claims are being appended to procedures inappropriately, we needed some strategy to get the people who are doing that to stop. And we hope that this will be it.
So this is really nothing but a targeted probe in education, apparently, similar to Medicare's TP&E program. So we will see what actually happens. I mean, you all read the letter. The letter is clear. The E&M line will be denied if they don't receive documentation. And yet he is saying otherwise. So what actually will happen? Who knows? Starting May 25th. So we will keep an eye on this modifier 25 debacle. It doesn't seem like things match. What he is saying clearly does not match what the letter says. So what Dr. Keat says that Cigna has a fiduciary responsibility to their clients and customers. What he forgot is that they have a fiduciary responsibility to their stockholders. Really, that is a huge part of why this is taking place. They are punishing everybody for the few who make the mistake of erroneously using modifier 25. They're punishing those of us who know how to appropriately use it, who document correctly, for the few who don't. Why don't they audit those who don't and not those of us who do it correctly? it's easy enough for them to target a few whom they think that are doing it wrong instead of targeting everybody. Although he recognizes that this is an additional administrative burden, this is just another cut and death by 1,000 cuts. The administrative burden adds up for every single thing that we do. Documentation requirements, compliance requirements, making sure you're running an efficient practice, the workflow is efficient, making sure your EHR is up and running, make sure your staff are happy. This is just another headache, another administrivia that we now have to comply. Medicare has its rules, Cigna has its rules, Aetna has its rules, United has its rules, the Anthem Blue Cross has its own rules. When does it end? So thank you for recognizing that this is an additional administrative burden, but you minimizing it, Dr. Keats, does not make it a good thing. So thankfully, apparently, there will be no clawbacks if you were not in compliance. So I'm hoping what he is saying is actually true. No clawback if you are not in compliance. Hopefully, this is truly an educational opportunity for practices that are not in compliance. Which brings me to the very important point of needing to understand what is modifier 25, when you can appropriately use it, and how you can educate your staff. So we'll cover that in a second. Dr. Keats, when he says, not as many patients will be affected as we think. Well, I beg to differ. For urology, just let's talk about BPH, right? Benign prostatic hyperplasia. 40 million Americans annually with this problem. We see this all the time. First time we see the patient, new patient with BPH, we schedule the patient for cystoscopy on the second or third visit after a urocuff or whatever it may be, right? On the second or third visit, the patient comes in for cystoscopy and maybe a transrectal ultrasound. So on that visit, after you do the cystoscopy, you see the huge median lobe or obstructing prostatic urethra. You discuss with the patient the results of the urocuff procedure. And then what? You're going to send him home and say, well, good luck. Or do you schedule the patient for a second visit later on just to discuss what you found and what you plan to do? That just puts more burden on the patient if you make the patient come back. That's just ridiculous. Most of us are not going to do that. So on that visit, when we perform the cystoscopy, 52000 CPT, you are going to talk to the patient about the meaning of the findings. Now, fully understand what is included in the global package of that 52000. It's the preoperative work, the intraoperative work, and afterwards you tell the patient what you found, making sure the patient is doing okay after the cystoscopy. What the global package does not include is, what does that mean? What does all of this data mean after you've accumulated the data? So findings, implications, treatment options, coming to a determination of how you are going to proceed with the treatment of BPH with obstruction. You document all that as a significant and separately identifiable piece of your E&M visit. Now you have a modifier 25 event. This is a common thing that happens in the urology practice. So when Dr. Keat says, oh, not as many patients will be affected as you think. Well, for every BPH patient who has Cigna that we're seeing, on whom we perform cystoscopy, almost every single visit will be a modifier 25 event unless you make the patient go home and reschedule the patient for another visit after that cystoscopy, which I think is not the right thing to do. So for urology, a lot of patients are going to be affected whenever we perform a cystoscopy for BPH. Not as burdensome? I beg to deliver. I beg to differ. It is a huge burden. So the key takeaways are, you have to play their game. If you want to continue participating with Cigna, you have to play their game. On the other hand, if Cigna is a small portion of your payer mix, if this burden is too great, or if they actually are going to delay payment to you until they match the supporting documentation, despite you checking the box, the elusive box, attachment included, if they are going to place a significant administrative burden, then you can consider dropping them as a payer, right? You have to know your data. You have to know your practice, how much of your practice comprises of Cigna. And of course, you have to consider the patients that you are going to be inconveniencing by dropping Cigna. Ultimately, I think understanding how to appropriately use modifier 25 is going to be the most important thing that you can do. Because if you are not doing it correctly with Cigna, you're not doing it correctly with Medicare, with all your other payers. And then you run the risk of possibly fraud, waste, and abuse, maybe non-compliance, clawbacks, maybe not from Cigna, but from your other payers. So understanding the appropriate use of modifier 25, when you can use it, when you should use it, and how you appropriately document the use of modifier 25 whenever it happens, I think that's going to be key. In the beginning of June, I will be in Austin speaking about coding, and I will cover modifier 25 in that presentation, and that's the Texas Urologic Society meeting. So if you want to catch me there, you can. And also, I recommend that you consider attending coding courses from the American Urologic Association, as well as those from PRS Network, also known as the Painters, in the annual Urology Advanced Coding and Reimbursement Seminar in Vegas this year, and also in New Orleans in January 2024. Modifier 25 appropriate use will be covered, and I invite you to consider joining us in those webinars. Knowing how to use these codes correctly will eliminate the worry of potential clawbacks, the headache of possible OIG claims on fraud, waste, and abuse, and just make you sleep at night much better. As usual, if you know where the attachment included checkbox is located, and is that on your practice management software, or is that on Cigna's website, please let me know in the comments below. And as usual, if you have any agreements, disagreements, questions, comments, please leave them below. Thank you so much for the privilege of your time. Please take care of yourself and take care of each other. Bye-bye.